Hello, Dr. Madhusudan. I'm Dr. Vishnu from Nayosmi Health Global Bulletin. I have few questions regarding new COVID variant JN.1.
Hi, Dr. Vishnu. So that's the talk of town, and you've got the real right question. And as you know, JN1 is just a coronavirus, and many people would be scared and worried, like what exactly it is and why even it's been called JN1. But let's be precise and simple. It's a Omicron virus only, and you would know there are so many sublineages in Omicron also, and one sublineage is called BA.2.86 that's closely related to JN1, and it was actually found in US. JN1 started in the month of September in US, and after that the cases have been slowly and steadily increasing, and recently in the first 2 weeks of December they said 20% of all positive cases in US were attributed to JN1, and likewise they are expecting 50% of it will be attributed to JN1 by the end of this month, that's December 31st. And likewise, the infection is spreading fast, and many are concerned what exactly it is, and it is just a Omicron virus, but only a concern point is there is one spike protein change in its structure. That could be a concern which many are worried, and WHO is also focusing on it. And recently, WHO on December 19th announced it as a variant of interest. Again, I'm telling you, it's variant of interest. You would have heard in our pandemic time wherein they mentioned variant of concern. So variant of concern is actually more severe, and now WHO is not designating that term to this, and it's telling it's variant of interest, and we actually need to be little extra cautious but not to be scared of this. Scientific fraternity is actually looking into its effectiveness, spread, and vaccine escape capability. But the booster dose vaccine actually was developed with view of recent developing variants, and XBB 1.15 that was a concern point then, and we are hoping the same vaccine will be efficacious against this also. But however, we should be little extra cautious, wear mask, sanitize your hands, and maintain your social distancing.
That was very informative, doctor. Thank you.
My pleasure.
Hello, doctor. I'm Dr. Navya. I have got one more question for you. Does JN1 cause worse symptoms compared to past waves? What should we watch out for?
Hello, Dr. Navya. That's actually what people need to know, and not to be scared. You would have been updating yourself with the COVID cases in India, and yesterday the Ministry of Health and Family Welfare reported around 641 cases. So that's the total number in India, and in that 314 were from Kerala, and likewise the rest of cases pan India. You can just imagine how least they are right now, and definitely yes, we need to be cautious for it, as JN1 have been confirmed in three states today, with around 19 cases in Goa, one case in Maharashtra, one in Kerala, and little cautiousness, little awareness on COVID prevention definitely helps us, and we have been through such a big pandemic, and I would think definitely this wouldn't be a concern for us, and we should be cautious. That's the only thing. As WHO has said, this is not a concern. We should be interested in it. Okay. And now coming to the main part, what exactly does JN1 cause to you? So JN1 is similar to other fellow Omicron viruses, and yes, there would be little fast spreading, if at all, and along with that, vaccine escape. We cannot assure that yet, and I'm hoping our vaccines definitely works for it. And now coming to the symptoms of it, usually in the reported JN1 cases, they tell they have initial symptoms of sore throat or itchiness or chest congestion or cough and fever, which are almost similar to COVID infection which we have seen earlier. And not to be scared, you should be a little cautious, and when you develop these symptoms, consult your family physician. They will actually guide you, and definitely please don't be scared for this JN1. We have fought the hell, and I will definitely think we can come out of this, and shouldn't be a concern for us. Thank you.
Thank you so much, doctor.